Yeah, hi guys. I just want to talk about vitamin D and why it's important. A lot of health benefits, a lot of good reasons to be taking it, especially if you have low levels. So I'm just going to talk about those. Major sources of vitamin D are the skin. The body can actually synthesize it, as well as the GI tract from dietary intake. Major dietary sources are vitamin D fortified foods like milk, fish, eggs. In the U.S., milk is the primary source. And sometimes you hear people ask about what the factors are for vitamin D synthesis and sun exposure, and there's two things that matter. One is how close you are to the equator, or your latitude. The closer you are, the more you will synthesize. The second one is the skin tone, and the darker your skin, the slower you absorb the sunlight to convert to vitamin D. So vitamin D absorption and metabolism is actually pretty complicated, so I'm not going to get into it too much. The biochemists out there will know what I'm talking about, but it basically, you absorb it in your small intestine and then transfer it to your liver and then to your kidney, and so it has to be modified a few times before your body can really use it the way that it intends to. So unfortunately there's more than one type of vitamin D. The one that you want to use is called vitamin D3 or cholecalciferol. And then of course if you have kidney or liver disease, make sure to talk to your doctor so that you're taking the right type, because your body might not be able to properly use the other ones. What is the function of vitamin D? As primary purpose is calcium and phosphorus regulation in the body. So when blood levels of calcium drop, your body will synthesize and use more vitamin D to bump that back up. And then there's another hormone called parathyroid hormone that works in concert with that, which I won't get into. So vitamin D has a lot of protective and beneficial health effects that I'm going to try to summarize briefly here. Appears to have a association with prevention of depression. So people with low vitamin D levels are more likely to have depression. It also appears to have protective effects against multiple sclerosis, Alzheimer's, and Parkinson's. So it can help reduce the risk of developing those diseases. It may have some role in sleep hygiene and sleep quality, although that's not well proven. It is associated with an overall reduced risk of death, especially in people over the age of 60. Excuse me. Low levels of vitamin D are associated with an increased risk of breast cancer, colon, prostate, pancreatic, and ovarian cancer. So if you have low levels, increased risk. Therefore, normal or super therapeutic levels will help reduce that risk somewhat. It does play a role in heart and lung health. I won't get into all the details. And appears to, deficiency appears to increase the risk of developing insulin resistance. So has a protective effect against diabetes and is associated with increased testosterone for all you weightlifters out there. Individuals with the deficiency will benefit from it as far as exercise and performance go. One study did note that supplementation may improve athletic performance and especially reducing risk of injury and fractures. Like I said, it helps with calcium and strong bones. Because of that regulation, it's also important in bone and joint health. So having an appropriate level will reduce the risk of damaging bone density, developing osteopenia and osteoporosis, and increasing your risk of fractures. So that's a good reason to keep your vitamin D levels at the appropriate level. Things that can cause deficiency most likely is inadequate sunlight exposure, especially at higher altitude or higher latitudes or farther away from the equator, and inadequate dietary intake. Those are the two big ones. But you can also have malabsorption syndromes if you have problems with your GI tract or liver or kidney disease. So make sure you are in touch with your doctor if you think that you might have something that would cause you to have a deficiency. Usually deficiency just leads to low serum calcium, and over time that can increase the risk for fractures and osteoporosis. It can also lead to something called rickets in children and osteomalacia in adults. I won't get into that. Vitamin D toxicity is very rare and pretty much only associated with people who are taking too much of it as a supplement. Wouldn't worry too much about that. Many professional medical organizations recommend supplementing vitamin D intake. And let's see, what else did I write here? It's worth noting that the darker your skin, the more sun exposure you need to generate adequate levels of vitamin D, like I mentioned earlier. So, for example, a Caucasian individual of Northern European descent generates more vitamin D than an African American individual with the same amount of sun exposure in the same latitude. So I do have the recommended daily allowances here, and it's generally considered safe to take levels up to 2,000 international units per day. For newborns under 12 months, 400 international units per day. For children age 1 to adults age 70, the recommended daily allowance is 600, and for adults over 70 it's 800. But again, for adults you can safely go up to 2,000 per day, and of course you can talk to your doctor if you need to do more than that.